Well, it is time to welcome our final live guest of the local vibe. The Triad Health Project has been a staple in the Greensboro community for over 30 years. They service and educate people in our area about sexual health and responsibility and are seeking to destigmatize those topics.
And next month, their annual Red Ribbon Day event will allow for them to do this on a much larger scale, and they are inviting the entire community to come out and learn more.
So this morning we have with us Adriana Adams. She's the executive director of the Triad Health Project. Good morning, Adriana. Thank you so much for being with us. Oh, we can't quite hear you. Hopefully we can get your mic back here in a second. But Adriana, when we do get it, can you try again?
Good morning. Thank you for having me.
There we go. Perfect. Well, we've kind of explained a light version of what you have going on, but can you go a little bit into further detail about what the mission is of the Triad Health Project?
Sure. Triad Health Project promotes sexual health and justice, and we do that by working to free our community from HIV, and we do that by focusing on the root causes of HIV, and one of those is stigma. So that's really what we're focusing on in our community in Guilford County.
And share with us, what is the fall campaign exactly?
So we really wanted to focus on that piece of stigma this fall, and so we launched a campaign that focused on stigma, and really wanted to talk to the community about how stigma plays into HIV in our community, STIs in our community. And so we have on our website ways in which stigma has really proliferated STIs in our community. And so we invite people to follow our social media, go to our website, and think about how stigma plays a role in STIs, also really keeping people in boxes, how we look at health. It keeps people from really focusing on their health. And so we have a great definition, a working definition of stigma. You might know a general definition of stigma as a negative or unfair set of beliefs that a group of people have about something or someone. But then we thought of another one that we've really worked with our campaign. And so we think of it as a definition of surrounding HIV and other STIs in a negative or unfair way, and preventing open conversations about sexual health. And that leads to a lack of knowledge, a lack of access to care, irregular testing, and even social isolation in our community.
Wow, I definitely understand where you're coming from with that. And we all know, like you've said, for years, the stigmas that have been around certain certain health conditions has been very tough. So what can we do in our everyday lives to help decrease that stigma for those that are around us?
I think the number one thing first is to start the conversation. One of the things that we really try to promote is just pushing into a conversation that might start out in an uncomfortable way. We have some tips for how to do that on our website, and we've also been promoting that through our social media, particularly around testing. We really want to promote testing as a regular thing. So often we have people who come into our offices. We provide free testing for STIs. We provide free testing for HIV, but we also provide for gonorrhea, chlamydia, syphilis, and you can get the whole list on our website. But people come in when they're in a place of concern. And what we want to promote in our community is people coming in as a regular way to check on their health, and also having a way to have that conversation. Often we hear that people are saying, you know, I have a new partner, or I might want to go in with a friend just, to see where my health is at. And so having that conversation, also have these conversations with your kids. If you're a parent, I realized when I first started working at Triad Health Project, I have young children, and I had never had a conversation with my kids about what HIV is. And that was a lacking on my part. So have these conversations and start them young, so that there's really a good knowledge in our community about what HIV is, how you contract it, but also how you don't contract HIV. That stigma is there, and it lives because we don't have the conversation.
Thank you for explaining that. We have about 20 seconds left. If you can tell us about Red Ribbon Day event next month quickly.
Yeah, so we have Red Ribbon coming up. It's on December 3rd, and it's our biggest fundraiser of the year. We have to raise about $200,000 so that we can keep everything free for our community. We are one place where people can access these free services. And so we need your help as a community. Come out on December 3rd and join us in this fun activity where we're going to do an advocacy walk. You can go to our website and find out more information. We certainly want you to come out. It's going to be a fun day. There's going to be drag, there's going to be a walk, and we're going to have a lot of good times.
Thank you so much for what you do for our community and for joining us here on the Local Vibe. TriadHealthProject.org is the website.